Hello, everyone. My name is Stephen Blackburn from District Administration, and welcome to our webinar here today, which is entitled Bridging the Special Ed Gap, 5 Strategies to Strengthen Co-Teaching Practices for Inclusive Education. And this event today is the second installment of our 5-part DA Leaders School series, where we talk about strategies and solutions to help reverse the summer slide before the school year starts. And this installment is brought to you by the generous support of our sponsor with us today, eLuma. And I'm going to go through my housekeeping items in just a quick second. But first, everyone, you can see on the screen, there's a poll right there. So if you can just tell us what your current role in education is by clicking directly on the poll there. We'd love your insights. So as I finish my intro, please take the time to take the poll. And as I said, some quick housekeeping items. At the end of our main presentation today, there will be a live Q&A with our panelists, as well as a special workshop. For the Q&A, you can submit your questions below via the red Ask question box. It's the one with the question mark and the chat bubbles, and you can do that at any time during the event. And we'll give more instructions for the workshop once we get to that point. After the live Q&A, post-event survey will launch on your screen automatically. So we do ask that you please stay on to the very end so you can take part. That said, if you do need to jump off early, you can access the post-event survey by clicking on the pink box there at the bottom of your screen. And also you can safely download some resources that are related to today's event, including seven leadership tactics that drive collaboration, and also a back-to-school checklist for leaders. And you can do that via the blue box there with the paperclip, also at the bottom of your screen. And lastly, you'll be pleased to know that everyone who's here today and everyone who registered, all of you will receive an email tomorrow from us at DA. And that email, it'll include a link to the slides as well as the on-demand video. And now it is my pleasure to introduce today's main speaker, Brandy Samuel, who is Director of Mental Health and Related Services at eLuma. Brandy, it's great to have you with us today. You may now begin, but first let's go over these results. I'm going to show them on your screen just so we can see who we have here in the audience. Looks like not surprising at all, mostly district level administrators. So hopefully that will help you, Brandy, in your presentation. But now I'll hand things over to you.
Awesome. Okay, well, thank you and welcome all you guys here. As some of you are wrapping up summer break and getting back to work, and some of you haven't even had a summer break, I'm glad that you decided to join today. Bridging the Special Ed Gap, Strategies to Strengthen Co-Teaching for Inclusive Education. Really just want to talk about today how we can make our practices to bridge any of those gaps, to break down silos, and really bring our general ed and special ed together so that we have an aligned approach and that we're working more efficiently and effectively as we reach and teach students. As we go through today, we're just going to kind of look at some of the current challenges of integration, rising special ed referrals, growing behavioral needs, persistent separation that's gone on for decades now between gen ed and special ed. I believe we're making a lot of strides to bridge those gaps and come together, but we still see that vast separation of us and them. Communication gaps and unclear expectations around all staff, and then how we can come together to improve student outcomes. I like to look at practical strategies, unified or collaborative systems, any kind of inclusive practices, really what is the least restrictive environment? And we all know that sometimes inclusion in general education is not the least restrictive environment. So really, what is that? How do we align our resources for all staff and all students? And then how do we improve our outcomes for all learners? Really looking at not so much proficiency or non-proficiency, but how can we garner growth year over year? And then, of course, we'll have time for question and answers. And before we really get going, just so I can make this a little bit more tailored to you, just one more quick survey. What issue are you most hoping to learn how to resolve? If everybody would just add something there, we'll give you a couple of minutes.
And I'll just jump in while we wait to say again, if you look at where the slides were, just click directly on your screen there. I know there's a lot of options, so I know that sometimes takes some time. But if for whatever reason you're not able to interact with the poll, you can put your answers within the attendee chat, which is at the bottom of your screen. I can see we have a few answers coming in from the chat there, but we currently have 36% of you. So, oh, there we go. Thank you.
I really love this. Just the create collaboration between gen ed and special ed. A, C, and G. Yeah, I can see that. I love the reduction of special ed referrals. What can we do at that more targeted tier of intervention? And what do we really do to improve outcomes, improve academics, grow outside of testing? And then C just seems to keep resonating with everybody, that general collaboration. So it looks like a good deal of us have answered. So you can see this. So mainly we're here today just to talk about the collaboration. And really there's so many ways. I say this anytime I lead a webinar or I host a webinar. I don't think we're going to talk about anything radically different here, but just bring things to the forefront, to the top of mind of what have we ignored that we could do better? What are we doing well or fairly well that we can improve upon just for the sake of our students? Just a little bit about me, 32 years public school facing. I was super fortunate to be in a vast variety of demographic areas, spent a lot of time in special education, also in school counseling and crisis counseling, and was very, very fortunate to be part of school turnaround, in which I was trained by the University of Virginia. So bringing all that to the table today and just experience and currently coaching educators and hope to work with everyone today. So the role of leadership, all of you here are school leaders and have gone up through the ranks. You most likely started out as a classroom teacher. You might have moved into a specialization, maybe a building assistant principal or principal, and then a building or district level administrator. The role of leadership in bridging the gaps that we see in gen ed and special ed is huge. In fact, it's vital to foster a collaborative school environment. And really, what did we all say? What did 55% of us say in this chat is we want to figure out how to collaborate between gen ed and special ed. And in order to do that, we must have leadership at the district and building level. So we've got to have that top-down buy-in before we get that bottom-up buy-in for collaboration. And here's a picture of silos. And sometimes I think we use the word silo a lot in education. And that's not the intention here. But what we hear, and over time, in the 32 years public school facing and 35 years around public schools, is I've heard so many times, well, special ed does this, gen ed does this, they do this, we do this. What we have to remember is every student that walks in our door is a general education student first. And sometimes we have to remind everyone around us, it's not here's SPED and here's gen ed. So one of the things that we can do that's very easy is just to have regular communication between gen ed and special ed. And maybe that's all you can do this year, is within your school, foster an environment that has transparent, ongoing, consistent communication between all staff. We need communication that's top down, but we also need communication that's bottom up. Sometimes we have teachers doing some dynamic collaboration in our buildings that we're not aware of in the principal's office or the counselor's office or the curriculum instruction office. So we have to have two-way communication. So as we talk about the why leadership matters, we're really in leadership. We're looking at several things. And three of those very significant things that we are looking at are staffing gaps, shared goals, and collaborative behavior. So when we have staffing gaps, as a school leader, I have to realize that I have to prioritize and share responsibility for all students. Now, sometimes some of us are in schools where we have a very high population or percentage of students with IEPs or special education needs. So we have to find a way to model a collaboration with gen ed and special ed so that we can reach all students efficiently and effectively. Shared goals. School leadership is going to set the tone for aligning staff around shared goals. As special ed and gen ed working toward the same thing. And I dare say that every person in this room is working toward improved student outcomes, reduction in discipline referrals, increased attendance, and not just increased attendance, but engagement once I get those students into the building. So are we using consistent strategies? Are we using common language? And are our goals and our outcomes student-centered? I had a conversation just the other day around scheduling, which we'll get into. And I was listening to some school leaders that I was working with and coaching around building a master schedule. And the schedule was being built for the staff, not the students. And I understand master scheduling. I was a school counselor, and master scheduling was my job. And some of you are going to laugh, but I've come to blows with some of my very good friends over master scheduling. But everything must be student-centered when we're working towards shared goals. Collaborative behavior. The school leader is going to set the tone for a spirit of collaboration in the building. We often have a hard time overcoming those silos and those barriers of special ed is this, gen ed is this. Special ed is a service that we provide to our gen ed students who require additional support. They may have learning deficits, they may have processing deficits, but there's some gap that we have to bridge and build. So effective collaboration, co-planning. Lots of us are having PLCs. Lots of us have co-planning time. Open communication. If I've built an activity that is a great reading activity, then I need to share that with the special educator, the general educator, the related service providers. We have to be open to sharing our ideas and having a wraparound approach for our students. And then just again, back to that shared decision making. When gen ed and special ed work together intentionally, we have a greater percentage of success in ensuring that all of our students, especially those with the need for specialized instruction, have access to high quality, grade level instruction. And I'm going to pause there for a minute. So when we say grade level, I already know some of you are saying, Brandy, I've got a ninth grader. He's 15 years old. He was retained. He has third grade reading skills. I can't present him grade level instruction. Well, how can I adapt that? Meaning he reads on a third grade level. Let's say in science, in earth science, we're learning about erosion. There are a lot of age appropriate materials that are nonfiction. So sometimes we have to think out of the box and we have to bring in nonfiction readers that are at their appropriate grade level to teach a skill. And we're going to really talk about how being a content area specialist and a special education specialized instruction specialist come together in these ways. How do we reduce this fragmentation? As a school leader, how do I break down these silos and reduce the fragmentation and the splits between gen ed and special ed? And I can't say enough, clear communication. Clear communication and consistent messages, it's a non-negotiable. Everybody in my building needs to hear the same thing. I was a middle school assistant principal for a period of time, and I was a special educator before I was a building level administrator, and I'm guilty of it. I communicated with my special ed staff in one way. I communicated with my gen ed staff in another way. And really, that's not okay. All staff needs to hear the same things. Think about if you're here as a school building leader and your district level administration communicates to one set of middle school principals in one way and another set another way. It's very isolating, and it kind of builds that fragmentation. So clear, consistent, transparent communication, non-negotiable on the part of the school leader. Let's model inclusive practices and meetings. Think about professional development, and just in the chat or thinking to yourself, or raising your hand, whatever that means. How many times have we crafted great professional development in our district, but it was only for special educators, or it was only for general educators, or if it was only for the school counselors? We really have to think about, when we're offering training or we're offering continuing ed or professional development, what would this provide to the general education staff? What would this provide to the special education staff? And maybe it's bringing everybody together. So really being intentional in how we train. And collaboration must be structured, expected, and supported. So if I'm going to have common planning time or PLCs, how is that structured? As the building leader, if I've never had co-planning time, I've never had PLCs, I might have to start with an agenda that I build for each group. And then I set the expectation of they begin building their agendas. How do I support? Do I make the PLCs in my building where myself as the building principal or my assistant principal are in every PLC? Or do I set it up where grade level leaders can be in each of those? Do I have times when district level administration needs to come to PLCs or co-planning? I'm not advocating that we don't let our teachers and our staff take a leadership approach, but when we're setting the tone, we may need to do that. We need to let everybody know in the building that we're supporting their efforts. And then role clarity. As a building leader, it's really my job, or even a grade level leader, to set the tone for role clarity. We don't want to avoid duplication of services. We don't want to have gaps in services because we didn't understand our role. So when we have role clarity, we increase efficiency, we reduce those instructional gaps, and we reduce the duplicity of instruction. So everything's more comprehensive. We're able to be more consistent and provide a higher quality of support and instruction. And we streamline our collaboration and our communication. Instructional alignment is so important. All of us in this room, no matter what state, we're teaching to and expected to provide students instruction around state standards, no matter that student's ability level. So when I align instructionally across gen ed and special ed through co-teaching, PLC, multi-tiered systems of support, common planning time, joint PD, and shared data, I'm able to build collaborative structures that guide the instruction, that provide instructional alignment. We want to have shared learning goals, all built around the standards, all built around the learning targets. And we're going to progress monitor in gen ed and special ed. Let's talk for a minute around academic standards and learning targets. And I already know some of you are saying, Brandy, same example. I have this student, he's 15, he's in 9th grade. He has a 3rd grade reading level. He can only perform 1x2 multiplication. That's the highest math skill that he has. How can I have him reach academic standards? So I'm going to ask you, how can you scaffold? How can you work with your special ed educator to build annual IEP goals that are objective based? I may have to start with backward design, which we'll talk about. We'll talk about learning ladders, and think about universal design for instruction. How do I reach all students? Even in your secondary environments, how do I create a center-based learning environment so that I can reach all students. But these are the expectations, and you guys know better than me, these expectations are daunting. And if I have multiple people in my building to rely on and align with, it's going to be easier for me, regardless if I'm a gen ed teacher or a special ed teacher, to reach those students and build an instruction that promotes and increases academic outcomes. So, disruptions and referrals. And you can do a thumbs up in the chat if you want. How many of you, no matter what grade level, school year 24-25 that we just wrapped up, compared to school year 23-24, how many of you saw a dramatic increase in discipline referrals than you did the prior year? So 24-25 school year versus 23-24. How many of you, if you would give me a thumbs up emoji or some kind of emoji in the chat, saw an increase in discipline referrals? So I'm seeing quite a few. I'm in some kind of conversations, I would say most times 5 days a week. And I've yet to be in a conversation with a school where they don't say to me, Brandy, I have more and more discipline referrals. They're starting earlier. The behaviors are more aggressive. The behavior's more intense. It's more ongoing. I don't know what we're going to do. I don't have enough staff to handle this. I don't have staff that's trained. This is one of the reasons, and I'm not saying this is going to reduce the referrals until we really have systems in place to address behavior. But the more aligned we are as a staff, the more consistent our messaging, our students realize that they're going to hear the same thing school-wide. I'm not going to have one set of expectations in Miss Samuel's classroom, another set of expectations in Miss Schuler's classroom. All of us are going to have the same set of expectations. We all come with a different personality, but we have the same expectations behaviorally and academically. So what's the root cause of the disruption in referrals? I think it's going to vary, and I believe it varies across the board. It's going to be based on your community, on your demographic, on your school-wide expectations. But if as a school you sit down collaboratively and you try to drill down so you can address some of the themes that we see for increased classroom disruption is a lack of differentiated instruction. And I also know what you're saying here, Brandy. I've already got 32 kids. I'm teaching 5th grade. We're departmentalized. My homeroom, I have 32 students. I can't differentiate. Think about center-based instruction. I can differentiate with center-based instruction at any grade level and any ability level. So if that's not something that you use, lots of information out there. Once I have a system built, it really works. But even better than that, I can collaborate with other staff in my building to build those centers together, and we share those. Think about co-teaching. If I've got 2 people, I'm teaching 5th grade, and I have 2 people on my team, and I'll just use my example. I taught with a lady named Julie forever. Julie was a fabulous language arts teacher. That wasn't my thing. So Julie and I co-taught during language arts, and she hated teaching math, and I taught math. So even if you're not doing a best approach to co-teaching, build on everybody's strength. Everybody in your building has a strength. So you can differentiate with what you already have, and you don't have to put more on your staff. Unmet academic or emotional needs. If I'm asked to read, and I can only read at a 3rd grade level, and I'm being expected to read 9th grade level work, I might act out. We have to recognize that and find a way to differentiate and break down. If I have unmet emotional needs, which I dare say, we are seeing more and more every day. And I can remember when I said this, I still hear people say it. You know, Brandy, I didn't come to manage a child's emotions. But you know what? If we don't manage their emotions, we're not going to teach math, and we're not going to teach reading, and we're not going to teach science. So we have to learn how to meet those needs. And again, we only have so many counselors, or you might not even have a counselor or social worker in your building. So think about, how can we meet everybody's emotional need by working together so that all of us aren't working more? And we hear this phrase all the time: work smarter, not harder. Everybody has a strength. Tap into it for how we reach the kids. And then inconsistent behavioral expectations. This is 100% something that we can align on in our school. Is it going to get better overnight? No. And oftentimes when we increase behavioral expectations, or we make those expectations more structured, we're going to see an increase in behavior referrals. We may see an increase in difficult to manage behaviors. But if we remain consistent, we use common language, and we teach what's expected behaviorally, over time, we will see a decrease in disruptions. And we all have the same expectations. We all have different ways to approach, but we all are setting the same behavioral expectations. Rising special ed referrals. I think we have seen a tremendous increase. In fact, I know we have seen a tremendous increase in referrals for special ed since 2020. We had students who didn't receive adequate instruction. We had students who couldn't be supported in the home environment. And so I question, are these performance deficits or skill deficits? And sometimes a performance deficit will look like a qualification for special education. Sometimes a skill deficit is also a qualification for special education. But remember, can we teach and build a skill without specialized instruction? The answer to that is yes and no. It really depends on where the students' processing skills lie, where their ability to think globally or to think in a problem-solving way varies. So we have to look at all those things. We also have to think, when we see these rising special education referrals for behavioral disorders such as emotional disturbance, we have to think, is this behavior a disability, something that the child needs to have specialized instruction around, or is this an environmental response? In schools, by building systems and collaborating and being in communication and aligned, we can respond to those environmental responses without a referral to special education. Is special ed being seen as a solution for classroom management challenges? And then some of these students really need some kind of formalized support. I want to back up to special ed as a solution for classroom management challenges. So in special ed and being involved in special ed the vast majority of my career, and I spent about 12 years as a special ed director. And prior to that, I was a coach and a coordinator for special education. I often heard, and I just had a conversation about this with two special ed directors yesterday. Well, we need to test, I'm just making up a name, Alice. And Alice has X, Y, and Z behavior. And once she qualifies for special ed, you guys are going to have to do something with her. You guys being special ed. That is a really big misnomer. Just because we evaluate a student for a suspected disability around emotional disturbance, that doesn't mean that child's going anywhere. We have an onus as a school and in alignment with IDEA Part B to be able to instruct those students in their natural environment. And I already know what you're going to say. I was a former teacher for center-based classrooms around emotional disturbance. Brandy, some of these kids have got to be in a self-contained room, and I agree. But it doesn't mean that that's not your student anymore. Remember, every student that walks in your door is your student. They're a gen ed student first, and no matter the student's need, behaviorally or academically, special ed is a service. It is not a place where we stick children. What is the service and the specialized instruction that we provide? So always keep that in mind and think about what are all the interventions we've exhausted to address a behavior? And is this special ed referral a classroom management tool? Because it's not. You know, we need to build those in for all teachers. Underlying systemic misalignment. So the main thing I hear, we've done some polls here at Illuma, and I've been to several webinars, I'm just going to say in the past 12 months, really looking at the collaboration between special ed and gen ed, and then just tapping into my own experience. Sometimes the special educator and the general educator have no idea what the other's doing. I'm a fifth grade general ed teacher. I go to a student's IEP. I give input toward present levels of academic performance, and that's it. And then I get the math goals, and I teach my math lesson, and I send that student to the resource room. I don't really know what the student does when she gets into the resource room. All I know is I'm going to teach what I need, and I'm going to send that student there. There's probably not going to be a great deal of growth in that student, because in the gen ed room, I may be doing something counterintuitive to that specialized instruction that the special educator's providing. On the flip side, if the special educator doesn't have a thorough understanding of the academic standards that gen ed teacher is responsible for, that student's probably not going to do very well. So if I come together as gen ed and special ed, and I think about ways I could pre-teach vocabulary, I could build some tools to go in the toolkit that are like little mnemonic devices to learn a formula or to break down a math skill. And I'm providing those to the student before she receives the instruction, then I'm really setting that student up for success. If I go to the math planning as a department, or I go to the grade level planning as the special educator, I'm probably going to be a more efficient special educator because I can deliver specialized instruction that's contextual to the gen ed instruction. And I hear a lot of you saying, Brandy, I don't have time to build in my special educators having a common planning time with grade level or subject level. So when we get to the piece about master scheduling, let's think about that. There may be a way that you can bring everybody together. All I'm saying is when students don't receive information that's congruent and contextual, the ability for them to meet standards, to meet objectives, to make growth is vastly diminished. We all have to be on the same page. Another underlying misalignment is we have an inconsistent multi-tiered system of support or response to intervention, meaning I'm meeting on a student, she's in 6th grade, and she's struggling with reading. She's reading below grade level. She's never been identified. She has some attention problems. She can't read on grade level, so therefore she's struggling in social studies, science, and math, not just ELA. What do? So we identified this through a common formative assessment, and we start this child through the multi-tiered system of support for students. I put in some targeted interventions. She's going to go to our reading specialist for some pull-out reading skills, and then we're going to give another common formative assessment in about 4 weeks, and we don't see any growth. So I don't get any input from the special educator on that MTSS team, even though we're not saying that child qualifies for special ed, but what we're looking for are specialized strategies, but we don't get that. So we do the same thing again for another 4 weeks. We don't increase the duration of the number of minutes the child goes to pull out. We don't increase the frequency of when the child goes to targeted reading center. What if we would included that special educator who already has some tools, some tips? Have you broken down the reading into segmented portions or into different paragraphs or so forth? So we need those gen ed and special ed perspectives. and I think I'm running behind, so I better speed up. When we don't align, we duplicate or we neglect support of students. So we want to avoid that. Clear communication, alignment. Ineffective interventions. I really just gave an example of that. We don't use data-driven interventions. We don't align our targeted instruction with the classroom, and we're not progress monitoring. Student needs. When students fall through the cracks, we have a lot of kids that stay at tier 2 forever. They don't qualify for special ed, but they struggle in gen ed without proper support. If we're aligning and meeting together gen ed and special ed, we can tap into the knowledge of our special educator, and then we're not communicating. Role clarity. We kind of talked about this a lot. I really like this. Gen ed teachers and special ed teachers, a gen ed teacher, when we look at curriculum, they're delivering that grade level content. The special educator is providing access to the content. If I'm co-teaching and I'm the general educator and I have my special educator in the room and we decide to break up into small groups, we divide up those groups. It doesn't matter if the student has an IEP or not. Ideally, if we're doing small groups in the classroom, I want my students with IEPs with the special educator, but I might put my tier 2 students in those groups too, just to see what some specialized instruction might do. Instruction, the gen ed teacher is going to plan for the whole class and differentiates lessons, whereas that SPED teacher is going to help with small groups or more individualized targeted interventions. Assessment, the gen ed teacher conducts classroom-based assessments, ongoing formative assessment, summative assessment, whereas the special ed teacher, when we get to assessment, and particularly with co-teaching, they're really just looking at that progress monitoring of students with IEPs. The gen ed teacher participates in IEP meetings. The special educator leads development and compliance of IEPs. Sometimes this chart is a super way to begin the school year to get everybody on the same page. This may be the place you can start this year. Manistee County, we won't spend a lot of time here because you can go through this, but Manistee County was a school that they were just trying to build capacity with their teachers. And the first thing they did was they implemented professional learning communities, or PLCs. They wanted just to align across assessments. They analyzed student data and they built interventions for all students. They had a focused use of curriculum and data. So they use their data to develop instruction across grade level co-planning. And we're going to talk about learning ladders, but we're also going to talk about what that looks like with backward design, and we'll get to that in a minute. They all received behavior support training that was consistent, and they integrated any kind of assistive technology. They gave visuals. We can provide low-level, low-tech assistive technology to any student, any kind of visuals, any kind of scaffolding or web, and then low-tech AT, which can be just a learning guide, if you will. It can be a word map or a learning web. They did collaborations. Here's their data and curriculum, behavior and SEL, and the assistive tech. This just puts it into a chart. Learning ladder. This is something, if you'll go back and read, but I'll show you in just a breakdown. This is really just a conceptual tool that breaks down the standards we need to teach into I can statements. But what it really does is it builds out what we want the student to do. But when we can take our end goal in mind and backward design in collaboration with gen ed and special ed, it's always standards aligned and it's always student friendly. For example, this is what it looks like. So I want the lowest level skill I want my child to perform or my student to perform is step 1. Identify the main idea of a paragraph, one paragraph. It might start as one sentence. Find key details, summarize a story, explain characters, and compare 2 texts. If my ultimate goal is, and I'm working and I'm collaborating gen ed and special ed, my ultimate goal is I want to compare 2 texts, I can backward design and figure out how do I need to get there based on each student's ability. So the Manistee case study, if you want to read that and go through it, it just gives ideas of how to build collaboration between gen ed and special ed. And always you can reach out to me. I would be happy via email to help you or get on a call. A shared school-wide approach. We've already talked about this: consistent behavior systems, inclusive instructional practices, collaborative planning and problem solving. We've talked about a school-wide behavior framework, shared expectations. Right here, we can embed accommodations. Modifications are a change in the curriculum. Accommodations, we can accommodate for any student. Maybe we have shortened response. Maybe we have verbal response. We can do that for any student. But if I'm the general educator and I ask the special educator for some accommodations, he or she is the expert. I can accommodate for any student. I'm not changing the curriculum. And then back here, co-planning, we're reviewing progress together, and we have shared responsibility. All students, it's not your kids or my kids. We have responsibility for all students in our school. Targeted scheduling. This is what I really want to talk about. So targeted scheduling, doesn't matter if you're elementary or middle. I'm going to stop right here. Stephen, I see some chats coming in that the slide deck is just spinning for people and not visible.
Oh, sure. Yeah. So if that's happening, just refresh your screen. So you just refresh your screen, and that should fix the issue, all audio and video. But if you are having issues, just let me know, put it in the chat, and I'll get to it quickly. But yeah, just refresh your screen. You'll be logged out and logged back in. But that should fix the issue. Thank you.
Everybody? Not sure what happened on my end.
Oh, let's see. So for you, is it not working for you either?
Now I believe it is.
Okay, perfect. Perfect.
Okay. So targeted scheduling and the master schedule. I know the master schedule is a beast. I spent years building and working with master schedules. So how do we meet the state requirements? At the secondary level, we all know we have a certain expected number of seat minutes, right? Seat hours. So we have to meet all the operational compliance. But how do we support student learning, teacher collaboration, and school improvement? When? What do I need? So how do I start with when? What are the academic goals that I have for my school? What are the priorities? Are we going to focus on interventions this year, like tiered interventions? Are we going to focus on enrichment? Are we going to focus on social emotional learning? Are we going to focus on inclusion and co-teaching? Do we want common planning times? I would advocate yes. Do we want co-teaching? I would advocate yes. Do we want advisory periods? So we're going to look at our student data and our staff data. The one thing I want to look at when I'm building my master schedule, staffing constraints and certifications. You guys at the secondary level, even elementary, I want you to think about this. If I have to have a special educator that's also highly qualified, I have some states that's a needle in a haystack. How many of you have a hard time finding secondary certification in math, highly qualified in math, with a special ed certification? I've been in a state or two where it's near impossible. So what can I do with my master schedule so that I can ensure that my students with IEPs, with math goals, are being taught by a special educator and a highly certified educator? And I don't have somebody with that dual licensure. I co-teach. I have my special educator push in. I use a co-teaching model. I'm not saying we cluster and we group kids, but how can I build my schedule and have a special educator dedicated where he or she can push into my math courses, or at least my higher level math courses? How can I construct a resource room so that I may have a learning assistant or paraprofessional that can provide academic support but not specialized instruction? That's how I really work on building that master schedule. How can I build that master schedule with all these things in mind? Co-taught and push-in classes first. When I'm building my master schedule, I'm gonna build it in where I can co-teach. A lot of you have teachers that'll volunteer to co-teach, and we're gonna look at some models. Align service minutes with gen ed instruction. And then you kind of avoid that pull out. Do I need to have a multi-grade learning lab to meet my IEP service minutes? Do I need to have a multi-grade intervention block to meet my service minutes? When you're thinking about your master schedule, get creative. And the best master schedules I ever built, I had input from my teachers, from my math and ELA teachers who were teaching those core tested subjects. Throw it in the hat, have a contest for a master schedule. Take a risk. You don't have to go with it, but you would be amazed at the input. But always think about the efficiency that I build when I bring in a special educator and a general educator. So I'm meeting that specialized license criteria and that highly qualified license criteria. This is something that I love. So truly reach out to me. I'd be happy to collaborate and brainstorm with you. Let's look at this one. Common planning time. If I can't co-teach this year, at least try to think of a common planning time so that everybody's aligned and communicating. As the special ed resource teacher, if I know what's being taught in 3rd grade ELA, I have a so much easier time of making it contextual for the student when I pull them out each week. Common planning. A lot of you have already got the structures in place, AB schedules, 90-minute classes, project-based learning for loop time, student choice. For your students who really need interventions, allow there to be a student choice time and use that student choice as an incentive to be able to become successful and grow on the interventions. So your students that don't need interventions get to choose enrichment or a project-based learning, while your kids needing that targeted intervention or remediation go to that. But we give them incentive to grow and move into a choice. One way to build in co-teaching is the ASCCR framework: align, share, collaborate, communicate, and reflect. This is a good way to co-plan. It really just builds in collaboration and getting everybody on the same page. But it's pretty essential, I believe, when we're working with co-teaching. We have to be aligned. We have to share what we're going to do, collaborate the teaching structure, and be able to communicate to families, to students, to administration, and be able to reflect and change our teaching practices. I'm going to go through this kind of quickly because you can read about it. This is aligning, sharing with each other. This is really good for co-planning time, or PLCs, professional learning communities, the collaboration, the communication, the reflection, and then breaking down the silos. Key actions for school leaders. This is just a redundant. I just can't impress enough what you as a school leader, the role you play in building these strong collaborative systems that get rid of the silos. Gen Ed and special ed are all in this together. Special ed is a service. It's not a place. It's a service we provide to all of our students. But as the leader, school leader, I must be here. And then co-teaching models. This is really my favorite part, and this is what I love. There are so many ways to co-teach, even if you just want to try it on a very small scale. One teaches, one observes. I'm up teaching. I have Ash, Mrs. Schuler in the back, and she's walking around helping students with questions or just standing by students that need to be engaged. One teach, one assist. It's very much the same as one teach, one observe. Station teaching. We already talked about this, center-based instruction. Work with my grade level. We each build a center. We can differentiate what we're teaching in math, and we hit all levels of knowledge, all ability levels. Parallel teaching. I'm just going to tell you, this one's hard until you've gotten a little co-teaching under your belt. You're kind of teaching at the same time. Or I start the lesson and my partner, Mrs. Schuler, is going to finish the lesson. You can tap into each teacher's strengths there. Alternative teaching. One teacher is up with a large group, one's pulled back with 2 or 3 students. Just whatever works in the setup you have. And then team teaching, it's taking turns. The whole key with co-teaching, best first instruction. Remember, special ed is a service. It supplements. Unless it's a student who's in a self-contained environment that has an intellectual disability. We are supplementing instruction, not supplanting. We're accommodating instruction, not modifying. So we're accommodating to the grade level. Benefits. We increase our support for diverse learners. How many of you have seen a child that you taught in, I'm making up a grade, 3rd grade, and it was a disastrous year? And you're just going to say that you had them the first half of the year. There was no behavior issue. There wasn't a conflict with the parent, but you could not reach this child and you switched them mid-year and you saw that child soar. Sometimes it's just a style. It has nothing to do with personality. So it's really a great benefit for students to see different teaching styles. Lower student to teacher ratio. I can split up my classroom into 2 groups and I can teach a small group. I'm teaching one group, the special educator's teaching one group, however we want to divide that. But when that special educator is in your room, I've had principals tell me, well, Brandy, the parent's going to think their child's in special ed and they're going to want services. That's not true. If we communicate, we're implementing a co-teaching model in math so we can differentiate instruction for all students. It's clear communication. What are we doing? My very favorite thing, it's shared expertise. Combines content knowledge, gen ed, with specialized strategies, specialized teaching for learning differences. I can't think of a better way to reach kids. And we all can't know everything. We're in a society where there's too much information. That's the number one reason: shared expertise and perspective. We have improved student outcomes. I can show you all day research that shows improved student outcomes with co-teaching for all these reasons. I love the modeling of collaboration for students. I was fortunate at one point in my career, I truly team taught. My kids loved, we were in 5th grade, and here I am using the term my kids. Julie and I, our kids loved seeing us work together. If we got any feedback from a parent or somebody in the district or somebody under the grant, they love seeing us collaborate. It's important for kids to see that at every level. And then that enhanced professional collaboration. Think about what you learn from your peers, your professional peers. We empower our general education teachers who don't feel like they know much about special ed. We have this ongoing professional development. We want to coach and have resources, but this one right here, we have a shared responsibility for all learners. If I'm a 1st or 2nd year general educator and I have 6 or 7 or even 3 students in my room with very specified IEPs that are intense and difficult to deliver, imagine the confidence that's built in me if I have a special educator I collaborate with. Just think about what you don't know and what you can learn from someone else. And it just fosters growth. It builds resiliency across your school team and adaptation. It encourages us to reflect, particularly when we're co-planning or we're co-teaching. We look at what's working and we reassess and we start again. We create safe spaces for learning and sharing. Why do we all need to build a unit on erosion? Brandy, you build the unit on erosion. Ash, you build the unit on cloud seeding. Whatever it is, we all can come together with different strengths. And then, Stephen, I was going a little long, but here we are for the Q&A. Sorry, super passionate about this very thing.
Through it at the very end, so no, you did a great job. So what I'm going to do is we're going to start the Q&A. We have some really good questions, but I'm going to go with this one for now, and then after I ask this question, then we're going to start the workshop, and if we still have some time afterwards, we'll get back to your other questions. But to people who haven't asked the question yet, just click on the Ask Question box at the bottom of your screen. I'm highlighting it right now so you can find it. And if we don't answer your questions, we at DA will send them to our partners at eLuma to get to your questions after the event. So let's go with this one, Brandy, and then we'll see what we have later on. So This person has a question on planning and collaboration time at the district level. And here's the question. What are some ideas you have on how to improve collaboration and planning time between core facilitators and special ed facilitators?
Some things that I've seen work all really go back to that master schedule, even at the elementary level. Like we may plan for when co-curricular activities are. If we're in block schedules, then we look at how we block and where we can separate and use more of those sped facilitators and gen ed facilitators. I mentioned just a little bit, identify times of the day that we're using a resource room, and we may have a paraprofessional that can support a student's independent work rather than providing specialized instruction. If we build our master schedule that allows for that, that often opens up flexibility and allowing those gen educators and special educators to meet. If we have block time for electives, that often helps. I'm not saying to leave out those teachers of electives, but find ways to communicate with them. But we're going to look at our master schedule to build out those different blocks of core planning time. That may look like we have a lot of districts, as you guys might be in, that are doing shortened days of the week or an extended day of the week where there's flex time earned at other times, so there can be that common collaboration and planning.
Perfect. Thank you very much. And we're now going to move on really quick to that workshop that I mentioned. So if you look into the chat, I just put a link in there, and I'm also sharing my screen as well. So for that link in the chat, that's so you can take part in that quick workshop I mentioned called Thought Exchange. Let's see here. And the question you'll be responding to is, what has your school/district done to align special ed and gen ed in order to break down silos? And no, you do not need to download anything, and you don't have to sign up to participate. So again, you can just click on the link that I put in the chat there, or if you look towards the media player box on your screen where Brandy was earlier, you should see some information on the screen with a giant QR code. Just scan this QR code here if you'd rather do it on your phone, and I'll keep this up so you have time to scan. So once in, you can share your thoughts independently or anonymously, and you can also rate the thoughts of others anonymously. Also, here's some added incentive to take part in this. So everyone who participates will receive the summary along with a report on these findings from our sponsor at Illuma. So the more thoughts we get and the more ratings we get, the more detailed that report will be. So remember, this is a confidential process, so your thoughts are anonymous and your rating remains anonymous too. I can see right now we have 19 participants in there with some thoughts and ratings already happening, so great. But in the meantime, I'm going to hand things back to Brandy. So as Brandy goes through her final slides to everyone in listening today, please continue taking part in the exchange, and we'll get to your results. So Brandy, you may continue.
Okay. So just in conclusion and kind of takeaways, call to action, we're at a time in education that we really have to make a concerted and an intentional effort to remove those barriers between gen ed and special ed. Think about what's contextual to our students. When we have a full wraparound approach and our students see that we're aligned around behavioral expectations, academic expectations, and our families see that too, the ability that we have to reach, engage students, and increase those academic outcomes greatly improves. It takes a village, and it really does. So let's bring it together. Prioritize system level collaborations, build structures, even if you only have to start with one thing this year, like shared leadership. You have grade level leaders that can take back the information. What can we do this year to have a more systems level collaboration? Department alignment. Does each department need goals that align with the overall district goal, the school-based goals? What can we do by department to bring alignment together? Lead with intention, empathy, and strategy. I think this is so important for school leaders. Intention, empathy, strategy, and then, of course, that communication. Collaboration can't just be a mindset, it's a mandate. This is what we're going to do. And I'm not advocating for those of you, it's not your style to micromanage, but lead by example. Center decisions on student needs while balancing teacher support and resources. Every decision we make in the building is student-centered. It's not what's going to benefit the staff. We want to retain our staff. I'm not saying we want to push staff away, but student-centered decisions are going to make teaching easier because we're directing, we're teaching, and we're putting students in situations in which they can be successful. Therefore, we decrease behaviors. Therefore, we retain more teachers. I dare say you can look at any educational statistic out there around retention, and the number one reason we lose teachers are demands and the behavior of students. Those are the two reasons. And be strategic. Think about your master schedule. Put a lot of heads together when building your master schedule. Where can I build in common planning? Where can I co-teach? Remember, I don't have highly certified staff in every area. So how can I bring everybody together? Start with volunteers to do co-teaching. Get buy-in. I've given you the models. Some of these are very easy to do. And the number one, most important thing, all the years I was a special ed director, and even now it sits on a big placard on my desk. Special education is a service, not a place. So we had 50 kids referred for special ed this year, and 40 qualify. And they are legitimate qualifications. They have processing deficits. They have neurological differences. That doesn't mean they're going anywhere. They're our students. Every student that walks in is our student. Special education is a service, and it's a way that a student accesses general education.